Hello friends. In this video, I am going to discuss about arteriovenous malformations. So among all the vascular malformations, arteriovenous malformations are the most important clinically significant malformations because they can cause significant hemorrhage. They may be located in the brain parenchyma, where they can cause lobar bleed. They may also be located in the subarachnoid space, and rupture of this AVM can cause subarachnoid hemorrhage also. So what is this AV malformations? If you see here, this is a normal blood vessel. Here the arteries are dividing into arterioles, then the capillaries, then the venules, and then the vein. So this is how normally the blood flows. But what happens in arteriovenous malformations? Here there are abnormal communications between the arteries and the veins. So basically there is a shunting between the artery and vein. So that means the blood is not reaching up to the capillaries. Blood is not reaching up to the capillaries. As you all know, the capillaries are the areas where the gas exchange happens. Okay, so through the capillaries, the oxygen is delivered to the tissues and the carbon dioxide is taken up from the tissues. So actual gas exchange happen in the capillaries. In this condition, because the blood is bypassing the capillaries, the tissue oxygenation doesn't happen. If the tissue oxygenation doesn't happen, the heart will try to pump more and more blood, but ultimately it will fail to reach the demands of the tissues. So that is why it will cause high output heart failure. So AV malformations can cause high output heart failure. If you look at grossly, they form worm-like vascular channels. Okay. A gene that is known to be mutated in this condition. Some of this condition is KRAS mutation. Because they have arterial component, the flow is high and they are pulsatile. The flow is high and they are pulsatile. Other vascular malformations like cavernous malformations, they do not have arterial supply. So that's why they are low flow and they are not pulsatile. As you can see here, these are angiographic images. You can see there is an nidus, and this is how the AV malformation looks like. So this is one important question. A newborn presenting with high output heart failure, and the imaging shows this. So this is basically vein of Galen malformation. Vein of Galen malformation. This is the vein of Galen, and this is the AV malformation, and it can cause high output heart failure in newborns. Okay, so that is all about AV malformations.